Is my muscle weakness actually caused by my thyroid? Have you been feeling unusually tired or noticing your muscles just don't seem as strong as they used to be? You might wonder if your thyroid could be playing a role. The truth is, thyroid problems can indeed cause muscle weakness, but understanding how this happens can help you figure out what's going on. The thyroid gland produces hormones that are essential for your body's metabolism and energy production. These hormones, mainly thyroxine, help keep your muscles functioning properly. When your thyroid hormone levels are off, it can directly impact your muscles. If your thyroid is underactive, meaning you have hypothyroidism, your muscles might become weak over time. This condition is called hypothyroid myopathy. It often affects muscles around your hips and shoulders and tends to develop gradually. At a microscopic level, low thyroid hormones cause muscle fibers to shrink and become weaker. There's also an increase in connective tissue within the muscles, and the muscle fibers change in composition, making quick, powerful movements harder. You might also notice stiffness, cramps, or even muscle enlargement, which can be confusing because enlarged muscles usually suggest strength, but in hypothyroidism, they can be weak. On the flip side, if your thyroid is overactive or you have hyperthyroidism, you can also experience muscle weakness. This type, called hyperthyroid myopathy, often affects the shoulder and hip muscles, leading to wasting and weakness. Sometimes, very high levels of thyroid hormones can cause episodes of sudden, severe weakness called thyrotoxic periodic paralysis. These episodes can last hours or days and are often triggered by high carbohydrate meals, salt intake, or rest after exercise. Distinguishing thyroid-related muscle weakness from other muscle conditions can be tricky. For example, muscle weakness from hypothyroidism can look similar to inflammatory muscle diseases like polymyositis. However, tests like blood work measuring thyroid function can help. If your thyroid hormones are low and your TSH is high, it points toward hypothyroidism. If you have symptoms like fatigue, weight changes, or temperature sensitivity along with weakness, your doctor will likely order blood tests to check your thyroid levels. The good news is that treating the underlying thyroid problem often leads to improvement. Restoring normal thyroid hormone levels with medication can nearly always reverse muscle weakness caused by hypothyroidism. Similarly, managing hyperthyroidism can help resolve muscle issues related to that condition. If your thyroid levels are brought back into balance, your muscles usually regain strength over time. If you notice unexplained muscle weakness, especially if it's accompanied by other symptoms like fatigue, weight changes, or temperature sensitivity, it's important to see a healthcare professional. They can perform the right tests to determine if your thyroid is involved or if another condition might be causing your symptoms. Remember, thyroid-related muscle weakness is treatable, but proper diagnosis is key to effective management. Always consult your healthcare provider for personalized advice and treatment options.